Well, some of them, yes. You're right, there are some unsubstantiated products around, especially on the internet, and I do think you've got to be very careful about vitamins. The thing is, unless you've got a clinical deficiency, taking extra vitamins is unlikely to do you any good, and in high doses there have even been reports that they can be harmful. Yes, I certainly do. And there is some evidence that omega-3 fatty acids, which is what's in cod liver oil, do help progression of arthritis, certainly in some people. Yes, that's right, but it is complicated. There are short and long chain omega-3 fatty acids, omega-6 in vegetable oils, and honestly, so it goes on. The important thing to remember is that the ones that you find in fish oils that have the anti-inflammatory properties, so they're the most suitable for people with inflammatory arthritis. Probably less so in osteoarthritis, except possibly when it's actually flared up and it's inflamed. That's a good point. It's the fish oils that we're after. The cod is not an oily fish, but the omega-3s are concentrated in its liver. They work slowly, so you will need to take them continuously over several months to see how they do work, and that means taking a supplement. Cod liver oil also contains vitamin D, which helps calcium metabolism, and vitamin A. That means they're not safe in pregnancy, and that's very important. In fact, in anybody, the dose is vital. More doesn't mean better, and it doesn't mean you get more effect, and in fact, it can be toxic. Check the label, get proper advice. Yes, glucosamine and chondroitin, which is often sold with it, are both natural products, both found in the cartilage in our joints. It's believed that taking them can help the repair of damaged tissues. They work slowly too, so again, you need to take them for several months to see the effect. Yes, they are, although glucosamine can increase blood sugar, so you need to check before you start, especially if you're a diabetic. You should also check if you're taking anticoagulants, those the things that thin the blood, and if you're allergic to shellfish, because many brands are actually made from shellfish. Yes, that's right. We've touched briefly on the most important, that's vitamin D. We need that because it helps the body absorb and process calcium, although it's not found in many foods other than the oily fish. Yes, it's synthesized in the skin under exposure to ultraviolet light. You don't need much sunlight, about 15 minutes in the middle of a summer's day is sufficient. Yeah, good point. Well, slight vitamin D deficiencies do occur in winter. And if you live in the north of the country, if your culture requires you to cover up your skin, or even if you use sun protection, then a supplement may be needed. Again, getting the dose right is very important. Yes, calcium is clearly the most important mineral for people with bone or joint problems. A deficiency causes osteoporosis, which is thinning of the bones, amongst other things, and calcium is important in bone metabolism generally. Yes, that's right, milk and dairy products like cheese and yogurt. And there's just as much calcium in skimmed or semi-skimmed milk because it's actually concentrated, maybe sometimes a little more. It's also found in most cereals, and it's added to soya and rice foods. And fish, the one we eat with bones, like sardines. Well, so many foods have calcium added. Yes, it is unlikely unless you're over 60 and if you don't eat a lot of these products. And there have been suggestions that calcium supplements can have an adverse effect on heart problems. So unless you've got a medical need, food is the way to go. No, not much. A healthy, balanced diet is what we're after, but that's good advice for all of us. Iron deficiency and anemia will occur in some people with arthritis, especially if you're taking non-steroidal anti-inflammatory drugs as well. Vitamin C is important, but a good diet with the recommended 5 portions of fruit and vegetables should take care of that. There is some evidence that large proportions of red meat in our diets can cause some forms of arthritis. So again, to avoid it to flare up, they're best avoided. Yes, that's a good point. There is some evidence that selenium deficiency is associated with the progression of arthritis. Now, mild deficiencies are common in the UK, and that's perhaps because the richest source of this mineral is in Brazil nuts, which maybe we don't all eat that often. But there are also suggestions that high-dose supplements may be harmful in the long term, so diet is probably the best source for many. And that means red meat again. And guess what? Yeah, that's right.